Well, tēnā koutou katoa, ko Monique Bradley, tōku ingoa. I'm Monique Bradley. Welcome to today's live stream here in association with Diabetes New Zealand. Thank you so much for tuning in for this second Facebook Live session, which is, of course, part of Diabetes Action Month 2023. While our overall theme this year is the topic of Eyes on Diabetes, today we are actually focusing on what self-care could look like for those with diabetes. We'll be chatting about some techniques that are high-tech and some techniques that are low-tech that you can manage easily. And as always, we want you to be part of the conversation. So I have a computer right beside me. If you've got any questions at all during tonight's chat, please feel free to send them on through, and I will do my very best to pass those questions on to our topic experts this evening. We will be looking at technology that is available for Kiwis living with diabetes and how that technology can provide valuable information and improve blood glucose control. Now, a significant focus, of course, for Diabetes New Zealand is really driving those campaigns for improved access to diabetes technology and, of course, better health outcomes for people living with type 1, type 2 and gestational diabetes. That's right, we are here for all of you. Now, tonight to speak into these topics, we have three guest experts in the studio here with me. So here on the couch right next door to me, we have Courtney Giddens, who is here from one of our champion sponsors, NZMS. Lovely to have you here, and which is a Dexcom company as well. Excited to have you here tonight, Courtney.
Thank you, Monique.
Kia ora. Me. Now, sitting here in the middle, the rose between the thorns, the thorn between the roses, who could go either way, is someone who is an advocate, of course, for self-care and well-being, and is here to share some tips and tools around exercise, nutrition, and mental resilience, which is, of course, a big topic. So we are delighted to welcome Stefan Crooks to our corridor tonight, who is another one of our Diabetes New Zealand champion sponsors with his amazing company. I'm such a fangirl, Vibe Drinks. Great to have you here and sharing your story with us tonight. Kia ora. And also, I'm delighted to have a guest who's come all the way from Northland, from Te Tokoro, Northland, Marriane Parker, who is the Diabetes New Zealand Community Coordinator for the area, to share her work, her amazing mahi, and some effective ways to manage diabetes. Kia ora and welcome.
Kia ora.
Lovely to have you here. Now, tonight, as well, as I mentioned on the chat, we are really excited to have you here. This is live. So, yes, I am with you right here. Lovely to see you. I can see people already sending hearts through. It's great to have you here. Send your questions through. If anything resonates with you tonight, remember, too, that we're here for you. We're here with you. And so is the amazing team at Diabetes New Zealand. So if you've got any questions around tonight's kaupapa, please send your questions through. And as always, if anything is triggering or getting your mind thinking, or you need some extra support tonight too, remember that Diabetes New Zealand has some amazing resources available. So you can actually head to their website, diabetes.org.nz, and you can see there's the free 0800 helpline on there. There is always someone at the end of the phone. So if you're feeling isolated, alone, you need help or support, or you've got somebody in your whānau that needs some help or support, make sure you get in touch. So tonight is all about how to maintain your well-being. We're talking about your circle of care, or if you're in the circle of care for somebody living with diabetes. And I know that technology has been a massive part of the conversation to maintain well-being. So Courtney, we're really delighted to have you here from NZMS. And you've been in this industry for more than 8 years. You've been an educator, of course, working with whānau across the South Island, I believe. You've come up from Christchurch to be here to help talk into this topic. And you're really passionate about educating and advocating. But I see here you've also studied biomedical science. So you have a real hands-on in the community approach, but you also come from that science background. So I'm going to ask you some pretty particular questions when it comes to technology. So first of all, tell us a little bit about the work you do and how NZMS supports people with diabetes, because I know that our followers really want to understand a little bit more about the work you do.
Yeah, absolutely. So thank you, Monique, for having me. So I work for NZMS Diabetes, which is a Dexcom company. We're responsible for distributing the Dexcom continuous glucose monitor and the Tandem T-Slim X2 insulin pump. So my role varies daily, so no 2 days are the same, and it's dependent on our customers' needs and what they require from us. But I'm part of a wider team that go out and educate and train not only healthcare professionals, but also our patients on how to use the technology.
Great. And it must be so rewarding to know that you're helping people maintain their wellness, and also especially when you're dealing with children, that must be hugely rewarding.
Absolutely.
Seeing that transformation for a family.
Yes, absolutely. I used to be a territory manager for the South Island, so I got to see firsthand the positive impact that using the technology has on not only the children themselves but their loved ones and their wider whānau. One thing we've also brought in last year was our Dexcom Warriors program. So this is a global movement that came in last year, and the idea of it is to bring people living with diabetes and their whānau together to, I guess, rally together to be the voice, to create a community where they can share advice and seek support from each other. We're holding a few social events coming up, so we do recommend, if there are any Dexcom customers listening, we highly recommend they join our Dexcom program.
I had a note here to say exactly the same thing, because I think it's absolutely phenomenal. So on that topic of technology, how does NZMS technology help people with diabetes? Because especially for those who might be newly diagnosed or they've got family who are, this technological area is a completely new way of dealing with wellbeing.
It is. And I mean, we have leading edge technology, and a lot of our families say to us, this has, reduced the burden of diabetes and it's giving us peace of mind. So we see firsthand the benefits of it. I guess to give you an idea of how the technology works, we have the Dexcom continuous glucose monitor. So that's a small sensor, and it just sits under the skin. It transmits data every 5 minutes to a compatible phone or a receiver, and it reads your glucose levels. Someone using Dexcom can be alerted if they're going high or low. There's also a predictive nature to those alerts as well, so they can find out 20 minutes ahead of a hypo event. So it's game changing.
Amazing.
It is really amazing. Living with whānau with diabetes as well, who find that really hard to manage. That must be quite incredible. Is that's technology that you're both using as well? No.
Yeah, I have used it.
How have you found that, Marriane?
What it does, it teaches you to understand how food affects your body. So you can eat something and it will show the spike. And then when you put your insulin in, it will show your body reacting to that as well. So it's really getting to know how your body works with the Dexcom. Well, that's what I've just used recently. So that's why I would push it on, to actually see how your body works and the different foods that change your body, the blood glucose in yours.
And from that data, can you correlate from the data with changes in your energy or your mood? Can you see that connection?
Yeah, definitely. With me, especially when I had the Dexcom 6 and now 7, before that, I would have to pretty much wait for my body to show me the signs of I'm getting tired. Oh, blood sugars are low or high. And it's either way. But with the CGMs, it's actually showing you up to the minute on how to do what your body's doing.
That's just incredible technology, isn't it?
It is.
I know one of the other products that you mentioned the Tandem insulin pump, and this for a lot of people living with diabetes is really new technology. So they may be familiar with the Dexcom, but this is just a game changer as well. Can you tell us a little bit about that?
Yes, I mean, if you've ever seen a Tandem insulin pump, it's the footprint of a credit card. So very, very small, not a backpack that some people think you have to wear when you do have diabetes. So the insulin pump is what people use instead of doing multiple daily daily injections. So in working in conjunction with the healthcare team, they'll put in their customisable rates and numbers into this pump, and what they'll then do is say, okay, I'm having this for lunch or this for dinner, calculate the carbs, put in what their blood glucose is, and the pump does the maths and will administer the insulin. So
that's absolutely genius.
Yeah, it's a pretty impressive technology.
Wow. So for somebody, my understanding is that somebody living with diabetes, and of course you can both talk into this topic a little bit more, you have to make more decisions than anybody who is not living with diabetes. You make more decisions every day, which of course can create a huge amount of stress and pressure. So what sort of impact does, that technology, what sort of, does it relieve that stress and that burden that people living with diabetes have to deal with?
I mean, there are lots of clinical studies that show the positive clinical outcomes of using CGM and insulin pumps. I guess what I really love about my job and what I'm really fortunate is to hear firsthand the patient stories and the positive, the mental health and wellbeing impact that it has on them. I remember it was just coming out of COVID, and I trained a family who had a wee boy who was a type 1 diabetic. And the mum rang me excitedly the next day, and she said it was the first time, and I can't remember how long, my son's come home from school, and the first question I said to him was, how was your day? Not what's your glucose levels.
Oh, wow.
The peace of mind factor is huge. The feedback from being able to go to bed at night and rest for a while rather than stress.
And of course,
Stefan,
I understand you live with type 2 diabetes, or have had previously type 2 diabetes, and you made huge life changes consciously to be well. And now you're this ambassador and you're an advocate for living well with diabetes as well. So when you were in that stage as well, just as a contrast, what was it like managing the type 2 diabetes? So we just have some data as a contrast.
Really, if I was brave enough now to actually seek a little bit more advice, I probably would have been able to affect change even faster.
Wow.
As opposed to not knowing what was available. If I knew it was available, I think the changes would have accelerated in me. And I know that for a lot of people, that if they just don't take that step forward to go and seek that little bit of help, so that you've got that peace of mind as a parent or as a caregiver or as yourself as the sufferer, we can make those little changes real fast. So, it blows my mind that technology could have, accelerated or even saved a life.
Yeah. Now, with you, Marriane, and working with Te Hauora or Ngā Puhi as well, and the community there, have you seen technology integrating into that community yet? Is that what you're seeing? And have you seen changes in how diabetes is being treated in the area?
The technology isn't there yet.
Okay.
So what we're more pushing is towards leading a healthier lifestyle.
Excellent.
So more pushing with the veggies, and even you don't have to go to the gym. Go out and you can put a garden and outside and work in your garden. That's simple little tweaks to the diet first. That's all.
I love that. And it's a bit more sustainable for a lot of people too, right? Yeah. Brilliant. And thank you, everybody. Oh, so good to see so many wonderful comments coming through. Amazing. Thanks, everybody, for your comments. It's wonderful to have you on the feed. And we're going to jump into some of those. So one of the questions that I have is, how can those in support of the campaign, which is #CGM for all, show this and help make a change? Because I can see in the comments feed that people are obviously asking for change around this. What can people do, Courtney?
Well, I think it comes down personally to education and awareness. As I've said a couple of times, I'm very fortunate in the role that I have, that I am able to have that customer contact. So I would say, ask questions, read the stories, and just listen as well to find out how maybe you can support people living with diabetes and advocate on behalf of them as well. So
I love that. Yeah. So
Obviously, not everybody is in a position, like we heard, the technology isn't in Northland yet, but obviously Diabetes New Zealand are doing everything they can in that advocacy space for people living with diabetes, which I think is fantastic. But let's talk about real stories and managing wellness on a low-tech basis. So, Stefan, your journey is really interesting as well. In my notes here, you were diagnosed with type 2 diabetes. You knew that you had to do something for yourself. You switched up your life. You got fit. You lost a significant amount of weight, which we were chatting about. Your story is quite similar to mine, pre-show as well. You looked at things like ensuring the right food gets to New Zealand kids. I think this is super important. So by creating healthier tuck shop programs within the school and the healthy school lunch program. And you are super passionate about sport. What's inspired this whole journey? Is this your own transformation and wanting wellness for others?
It's kind of funny. Like I've got to go backwards to go forward. So I've dealt with diabetes and type 2 diabetes for 30 years with parents. So in stressed environments where you're watching and managing the highs and lows, the technology that's around now that could have saved a number of, dare I say it, lives. So when you bury your parents and understand that you are suffering in your own journey, knowing that we're all intelligent, that we're all smart, that for every dollar I could get for you should go to the gym or you should change your diet, not understanding your why, and not understanding, what that mental side of this game really is. And so after burying mum and dad and then, being reasonably successful in business, I realised I was on a journey towards the grave just like my parents were. And I got diagnosed in 2015. After being tested, and as that slippery slope goes up, not down, on an HbA1c where it went from 45